everyone. People with diabetes who are on insulin therapy must have observed that whenever they visit their doctor for a follow-up, the doctor always checks their insulin injecting sites. Have you ever wondered why does a doctor check these sites? They check it to rule out the possibility of a lipohypertrophy. What is lipohypertrophy? How do we diagnose, prevent, and treat it? Lipohypertrophy is a common complication among people with diabetes who are on insulin therapy, especially adults and children with type 1 diabetes mellitus. In short, lipohypertrophy is a fat accumulation. It is the development of a lump of fatty tissues under the skin, which is caused by repeated insulin injections on the same site or by using the same needle of the pen or syringe multiple times. These lipos vary in shape and size. One of the other reasons which could cause a lipohypertrophy is not taking the insulin injections through the correct insulin injecting techniques and by not rotating these injecting sites. To prevent a lipohypertrophy, it is important to check these injecting sites regularly. Injecting on the same site, which already has a lipo, can lead to hyperglycemia due to poor absorption of the insulin, which may lead to an increase in your insulin dosage. However, if you do increase your insulin dosage and then proceed to inject it on a non-effective injecting site, it may then lead to a hypoglycemia. Therefore, it is very important to diagnose lipohypertrophy. So how do we diagnose lipohypertrophy? The first thing you have to do is stand in front of a mirror and observe the sites where you inject the insulin regularly and check for a lump or a hardening. You have to use your fingertips and you have to move it in a circular motion in that injecting site. If you spot a lump or any hardening in that area, then avoid giving insulin in that particular area. Another way to diagnose lipohypertrophy is while having a bath. Apply any water-soluble gel or soap on your injecting sites, again in a circular motion. If you find the area is hard or is lumpy, then please avoid injecting the insulin in that particular site. If you find it difficult to understand, then compare your left side to your right side and check if you find any abnormalities. So now that you know what is lipohypertrophy, how to diagnose lipohypertrophy, so let's move on to how to treat it. It's very simple. All you have to do is avoid injecting in that particular site for a minimum of 2 to 3 months and let it heal on its own. Also, remember to frequently change the insulin needle and injecting sites in order to prevent lipohypertrophy. Thank you.